I was in Denver. Actually, I realized how outdated some of the bio gets to be with speaking. I think I've been speaking at Oregon Right to Life for over 20 years, and that saying I'd been focused on the family for 7 years. I actually been there, as I thought about it over this week. Wednesday, Thursday, and Friday was in Colorado. I've been actually there going twice a year for 18 years, so I'm kind of the token Catholic among my brothers and sisters in Christ for Focus on the Family. Gail called me a couple days ago. I think you may have heard and was blessed with the opportunity to fill in for Dan, who was to talk about the Obamacare and its effect, or rather the so-called Affordable Care Act, and how its effects on stimulating or promoting abortion. And so I assure you that I'll do that, even though the title here from an updated talk that I've been working on in the last 24 hours, be sure it's for fresh material for you. And so you can put that down in your evaluation that it's fresh material. At any rate, but you won't have to worry that I'm going to be talking about abortion in this talk. In fact, I often get accused by my colleagues at OHSU that can I stop talking about abortion, because I see it in everything in the sense of poor choices that people make. One of the gifts I have with the blessings that I went from arguing, well, not only with my priests about things when I was young and dumb, but also with my wife about openness to children. And one of the things by being blessed with 7 kids after I got past my hang-ups about being open to life is to, gently chide my colleagues in the evangelical world that you've got 2 kids, that's great, that's a good start, you've got 10 to go, This is, so at any rate, this title is not totally joking, and so I'm going to touch a little on financial issues, because this is also what pressures people to do the wrong thing and think that it's good to try to save money and all. And I'm also going to be talking, and I'll weave in here a little bit, some of the points I'll make in a couple of, or at least one other talk on today on conscience protections. But at any rate, I want to show where we were last time I gave this talk, and we're past this problem in terms of the national issue of signing up for Obamacare. But as you know, in this state, we actually scrapped the system. In Massachusetts, who had it since 2006, they just scrapped their system in order to save money and basically dump the load of the signing up and administrative process on the U.S. government, the taxpayers, you and me. And it does cost money to do these things. But, there's pledges within the administration that we're not going to change anything, no one's going to take your health care away. And this was where we were just 2 years ago, or a year and a half ago, and that we got the Fact Checker Award, or the Pinocchio Award of the Year from the Washington Post. The concept of lying about lying, and this is the problem. You've heard Nancy Pelosi say, we're not covering abortion in this, and it's going to come out very clearly that it's hard to escape now with all the court cases around this, but Obama denies promising if you like to keep your health plan, you'll be able to keep it. It was videotaped 30 times. It's astonishing to me how our leaders think somehow that videotape doesn't exist, and then, well, that's not really what I said, even though it's captured 30 times. What I said, you keep it if it hasn't changed since the law was passed. And so it's breathtaking, though, in my mind, that our country is so tolerant of these absolute, not misstatements, they're absolute lies. That the correct English language, the King's English, is that lies. And I'll point out that the administration knew about these untruths, is the kindest way you can put the word lie, but it's a lie. They also said that we're going to get a lot of people covered. For years, when at the university, we try to teach about health promotion, wellness, and trying to get more people covered who aren't getting covered, or trying to get more people health care, because this is part of the morbidity and mortality in our country. And we've always talked about, 47, 49 million people uninsured. And of course, this was supposed to, yes, we'd be spending trillions, but they didn't tell the truth about that as well. They said it was under the $1 trillion by a lot of fancy accounting that was deceptive. But we're going to be 16% of the people basically uninsured, and 49 million in 2010 and 48 in 2012. And even though you had dropped the number of uninsured, there were a lot of policies canceled, and we'll get into that. We're already now seeing, as the tax season rolls around, and we're very close to April 15th, as people are getting a fine, and you'll see the numbers on this is down $95 for those who didn't buy, and there are a lot of people who didn't buy. And by the way, that's not a bad decision economically, you know, and I'll get into some of the numbers about that. And the penalty triples this year for, you know, when you pay your 2015 taxes next year, and it'll triple to $325. The maximum will be close to $1,000. So this is not chump change when you're talking about tens of millions of people across the country. And this is also part of the cost, which is not calculated, or they call this as an offset of the actual cost of this system. And despite all these incentives or disincentives, there's a huge number that remain uninsured. In fact, President Obama in his annual State of the Union address celebrated and boasted that we have 10 million people covered out of that 47 million people uninsured. I'll show you some math with that lately, and it's just staggering, the math of how much has been spent to cover 10 million people. So this is the latest numbers that Gallup has done. They're from 2014. There are no more recent numbers about this question. And I want to show you here that indeed there was a pretty steady, like I said, over years we talked about 16, 17% of the country being uninsured. And it has dropped a bit here. A lot of this, most of it is actually expanding Medicaid rules, which you could have done without Obamacare, couldn't you? I mean, you could have simply paid for that. And this is an incredible problem that you have the federal government now regulating things with the guidelines that were put in place by Harry Reid and Nancy Pelosi, who aren't exactly, well, they're not here at this conference today, I don't think. That's the point. So we're down to 13.4% is the point here as of April, which is the latest numbers that we have in terms of people who are uninsured. 13.4% times the 330 million people, still a lot of people uninsured is the point. It's over 30 million easily, if not closer to 40 million. The premiums are starting to rise. The 27-year-old earning 2.5 times the poverty rate will pay an average of 7% more for the lowest cost bronze plan. Now think about this. The inflation rate in some years recently has been close to zero. It's 2%. That's why your bank account, you have 0.05 interest on your money and the like. The lowest cost silver plan will rise an average of 9%. The lowest price catastrophic will climb almost 20%. This is per the Congressional Budget Office, which is a so-called neutral organization that gets somewhat huge pressure from the lawmakers, even though it's supposedly neutral, but it clearly says there'll be less than 10 million enrolled by the end of this year. So even Obama's 10 million is a little bit generous with respect to the exact numbers, but the estimate was supposed to be 13.3%. It's not growing at the point because many people are seeing some of the problems that come with this well-intentioned, I'll give them credit for some lawmakers wanting to help people, but this, I think, is a misguided attempt. By the way, it's okay to disagree with me if you don't share my views about this. How many of you have benefited by Obamacare here? And there may be some people here who've gotten insurance where they didn't. How many people have benefited? I see no hands. And there's at least 150. Was there a hand over here? No, okay. So it's dramatic that we're doing all of this, and so few people do I run into. I do have a colleague who just swears by it. She thinks it's just the greatest thing since sliced bread. She didn't have insurance before. She's in between jobs. She's in school, and in her midlife, latter part of midlife, and she thinks it's good. So I'm not saying that this is not good for some people. It has been good for some people. But at what cost and what control issues in terms of boundaries for morality and the like. So the cost was initially under $1 trillion, and they really worked very hard to jimmy the figures. That taxes were coming in for 10 years, and the actual delivery was going to be for 6 years. That was one of the ways to jimmy the figures. Others are taxes that are hidden. I'll talk about in a minute. But a better estimate now is it's $2.6 trillion as of this 10-year period from 2014 to 2023. 2.6 trillion. That's a number. Trillion. What's a trillion here and a trillion there? You don't get an idea. So I thought I'd break it down for you. I had math and science. I was in aerospace engineering before, so I'm pretty good with numbers. I'm not as good as I used to be, but I'm pretty good. This is what 2.6 trillion looks like. It's 2.7 times 10 to the 12th, and so that I put that in that scientific notation because it's easier to do math. The number covered is 10 million. I'm going to give the president credit for what he said. It's close enough. It's 9.9 according to the budget. And that's not now, by the way. That's by the end of this year. So you divide the 1.107 into the 2.7, and you get 2.6 times, I forgot to put the number here, 2.6 times 10 to the fifth, which is close to 270 if you round up $1,000 per man, woman, and child. Now this is for children. This is for 6 year of coverage, so you divide it over 6. It's over $40,000 per man, woman, and child. That's the average salary of a working person in the United States. That's a working person because about 47% of the United States doesn't work right now. This is to put in perspective what we've accepted. And why it's important for us to understand this, it does relate to abortion, because when you have these kind of costs, you then have to look at ways to reduce your costs. Like we want to not have many people pregnant. We'll save costs by not having the pregnancy go to term. We'll certainly want to keep people from getting pregnant. So I wanted to make sure that I slip in here the title that was supposed to be this talk of the Affordable Care Act and its impact on abortion. So there are other problems, and again, I've updated these from the last time I talked about the Obamacare, which, by the way, is not a slur. Obama himself said he likes the term, so it's not a slur. I don't want you all to think that when you say Obamacare that you're somehow offending the president. He said he kind of likes the term. He likes it. This is his legacy. This is his child. This could be a place where I'm for abortion. I'm sorry. It's inherent design flaws. Young need to avoid new health plans. If I were young, I'm 66 now, but if I were 26 and I didn't have a job and I was in between things, I think it would be a very bad investment, is my point. At most, I would buy a catastrophic insurance policy so they wouldn't burden my family if, God forbid, I got leukemia or something like that. But that's what I would do. That would be I would tell my dad to do that if I didn't have the money myself, if he were still alive. That's what I do. So they predicted about 22% of young people would be involved in paying for people like me. Now think about the justice of that. In earning power, I'm in the prime of my life, even though I have gray hair and back pain and that sort of thing. But as far as money, I'm blessed. Why should my kids, who I have to pay for right now, still, they could be in their 30s, I'm still paying, but why should they pay for me? What justice is in there? If you care about social justice, this is part of the Ponzi scheme, if you will. And why is it a Ponzi scheme? There are not enough kids. That's why I'm having all the grandkids I can to try to support your Social Security and Medicare. This is how you keep things going. And how, I could give another talk about the population implosion, but, Putin, the KGB guy, is trying to get into Croatia. He's paying Russian mothers to have their third baby, an entire year's wages. And there's 122 countries that give incentives to people to have more children. So this injustice was recognized by at least, 15% of the people in the age category from 0 to 17. It's also came in under for the 18 to 34-year-olds. It went from, I think they wanted 28% and 25%. And here's the heavy load in the working people and also the older people over 55. And by the way, the people over 65, that'd be me now, if I weren't working still at OHSU, who would be taking care of my medical costs? Well, all of you would be if you pay taxes. You'd be paying for me with Medicare. So it's really a small group of people here because we already had about 50% of the people covered by some government program anyhow. It's just remarkable. So only 5% would lose their plans is what they said. Many employer-based insurance plans. They estimated, by the way, this was McClatchy, D.C. in 2013 said it'd be closer to 30 to 52 million that have actually lost their plan. Employer-based insurance plans also could change. I hear this from people all the time. They have to change their doctor. They have to change their plan. This is really not unique. It's not unique to Obamacare, by the way. It was happening before. But the reality is that we should have had laws that gave universal coverage to people whether they moved across states. You could have done that without spending a dime. You just say all insurance companies have a level playing field. They have to cover, if you want to cover your kids up to 26 or 36, we could have decided that without having to spend a dime. You could have just said it's a mandate. You have to do that. I actually don't want to be covering my kids when they're 26 and 36. I'd like to have them have a job. But again, you have to look at what are perverse incentives that we set up that create dependency as opposed to independency. So this is actually now the Congressional Budget Office, which is pretty neutral about some things. It said now 10 million will lose their health class, a 10 times increase from what they initially said. Change in job-based coverage. This is all from the CBO, and it basically goes, if you look at the numbers gaining coverage, this was the forecast, this is actually the reality, and this again is still estimates. This is the only part that's real, is over here. These are estimates, but they're already acknowledging their estimates were flawed or not truthful, whichever way you want to look at it, from the beginning. But the only part that's truthful here, these are projections. And then the change in job-based coverage, their initial projections were the dark blue line, and now they've changed it to say there's going to be huge changes in the job market, is what this tells you. So Senator Enzi actually understood that this was wrong. He looked actually in the 2,700 pages and read what was put in there, and some of the things he said that you can't keep your insurance, you'll all be forced to buy. And now these policies now include mandated abortion coverage. And this is what you see all these court cases in right now, including I couldn't believe the Little Sisters of the Poor is still outstanding in the sense of not really being finally settled. And of course, they have to fill out forms, and the Supreme Court came out with, I think, a really short decision that they could just fill out a form and it'd be all good. And maybe it would be, but the point is that a lot of businesses that have integrity, and this is the conscience issue that I'll talk about later this afternoon, they really are at risk. And it's not theoretical. It's already happening in our society in Indiana and the like. We'll go into details with that about more. Conscience protection is really at risk with this. And keeping your insurance is one of the broken problems. He actually saw this coming, and he wanted to introduce legislation to make the president's promise, that is, if you have your insurance, you like it, you want to keep it, you can. This is about the people who are uncovered. That's what this law is about. You shouldn't fight it. Every Democrat, and again, I'm not a political person here and talking about Democrat, I'm just saying the behavior of every Democrat was they voted against legislation that would make the promise come true. And that is a fact. And so here you have the former Senator Mary Landrieu. That's changed since the last time I talked about this, because she is no longer in office. And she was one of them who actually voted against it. But she tried to redefine the grandfather clause in a desperate attempt to do exactly like Father Tad said, their most important thing is to be reelected. And so then she changed her tune. Of course, she didn't convince many of her Democratic colleagues to go along with her, and they continue to want to defend Obamacare over what was really just. And she, along with all of her Democratic colleagues, as I said, had voted against the 2010 and then tried to save the ship and keep herself from drowning and losing the election, which she did do later. Even people who are very much supporters of not only the president, I mean, they're people who volunteer their times. These are two Democrats in San Francisco. He's an architect. His wife, with typical postmodern, has a different name than he does. But they're cradle Democrats. They support him with Organizing for America. They worked phone banks themselves. But they saw a little sticker shock when their Kaiser Insurance, which is solid coverage from their mind, they liked it, they wanted to keep it. It's an organized system that's been involved in healthcare ever since World War II with the Kaiser shipyards and all, and they were innovative with a managed care system. It's hardly a fly-by-night company. This is what the Democrats said. If you lost it, it was because they had lousy insurance and they didn't meet the high standards of Obamacare. Well, they had their policy canceled. Their new policy is certainly not any better. It does cost more, and it costs $1,300 instead of $550, so it's more than double. And they have higher deductibles, higher hospital costs, and in fact, they now have to absorb 40% of the cost of their hospitalization instead of their previous Kaiser, which would have been close to zero. How many of you have Kaiser insurance? Yeah, quite a number of you. If you go in the hospital, how much do you have to pay? Not much. All right, that's correct. All right, you're like a medical student, you give the right answer, or you just a general, you're right, that's it. All right, so they literally attack with this line of thinking that you had lousy insurance. Here's a woman, Edie Littlefield. She had excellent cancer treatment, been treated for 7 years. She wasn't able to keep her insurance. Her doctor, primary care doctor at University of California, San Diego, I know that's quite good. I know Stanford's quite good. Oncologist, she wanted. And the title of the article in the Wall Street Journal is, how low can you go to actually attack this person as though she had lousy insurance? And yet that's exactly what was going on. So you have popular provisions, like you can't reject people with pre-existing condition. Again, you could do this without spending a dime. You just mandate by executive order, since our president does it all the time. You don't even have to have Congress go along with you. You just simply say, you got to insure people regardless of what conditions if they switch insurance. And every insurance company would be subject to the same rules. That's all you'd have to do. And if you want to have 26, 28, whatever the dependency age that you want to set your people free, cut the umbilical cord, you could mandate that. It's not something you need to spend any money on. So you need to cover an estimated 5 to 50% increase in payouts is really what's happening. And this is from Kaiser's Research Center, which is one of the premier people. There's actually a Kaiser Research Center right here in Portland that keeps health statistics, and they're a very authoritative source, and they're hardly against Obamacare. I mean, basically a lot of the health insurance were colluding with this implementation. Part of the reason why these controls cost money is you can't charge people like me more than 3 times that you would charge for a younger, healthy person. And so, well, if you can't risk stratify your population, then you're going to have the people who are healthy paying for the people who aren't. This is part of it. Sounds good, but the reality is it's not truly insurance anymore. It's basically covering the costs. I'm not for or against, I'm just stating facts here. The insurance cost for the young is soaring because you've got to cover that cost somehow, and that's why the young are getting disproportionately charged for the health care of people like myself, who thankfully, I'm as I said, I acknowledge I'm not impoverished. So here's a liberal columnist. Obamacare options are grim for young people. This is what she said. If young people choose to voluntarily give their hard-earned money to their elders, whether grandparents, neighbors, or friends, to help with medical health, that's their prerogative. But it should be their choice. She's a pro-choice person. Not another burden forced on them by the Burmers and their ilk. I'm the ilk. I mean, I like kids. I mean, this is the class warfare that we're setting up in our culture. It's sad. I testified a week ago, 8 days ago, at the state legislature, something that I didn't think you'd really have to testify for. It's basically a bill that is supposed to ensure that regardless of your age, that you would still have access to all the same health care that you would have if you were 25. Is anybody against that? Well, I had to spend, my afternoon on Friday to try to promote it. We're only 2 of us and 4 of the bill. It was a remarkable testimony. I'll just give you one little anecdote about that. I had a 98-year-old patient 13 months ago that I shared with a committee, and he was in the hospital because he couldn't urinate. The doctors, very good doctors, by the way, this is at OHSU, thought he was constipated, which is a cause sometimes in older people of not only not being able to go from one end, but sometimes it affects the other end at the same time. The wiring is kind of crossed over there. At any rate, so they get rid of the one problem with the rear end, and they presume that would help the front end. He went home with a catheter, and it was pulled, but 2 weeks later he's in with abdominal pain again. He's about to be discharged from the emergency room, and I happened to come by the emergency room, talk to the doctor. This guy doesn't really complain about things very much, He's pretty stoic. He's active. He actually works 15 hours a week, donating his time. I think he should do a CT scan. They did a CT scan. They found that the bladder had herniated into his inguinal canal, essentially an inguinal hernia with the bladder. This caused him to be obstructed and have abdominal pain. I then had to encourage my friendly surgeon, who's a good surgeon, by the way, he's not a bad person, but he again, this might not help him, and weighing the risk-benefit of operating somebody who's 98 years old. I said, he's a tough guy, he's gone through other surgery. I have to be an advocate for him. You need an advocate in the hospital system now. So he kind of agreed, okay, I'll do it, but I wanted to warn you, this might not turn out so well. So he does the surgery, he gets the bladder out of there, fixes the hole in the hernia, basically, and 2 days later, he's sent home. That man, my patient, is about to celebrate his 100th birthday in about 3 days. So it's what you have to do. So the false pretense is sold as a way to achieve universal universal health care insurance coverage for all Americans, but still it leaves 31 million people uninsured 10 years after full implementation. That's not my speculation, that's the Congressional Budget Office. So we're doing that at the tune of, even if you accept that we're saving money with some of these things, it's only $1 trillion. You do the same math that I just did, and instead of being $260,000 to $270,000 over the 6 years, now we're talking about $100,000 for the 6 years. Now you're talking about $16,000 per year per man, woman, and child. How many of you have had to spend $16,000 on your children, your babies in the last year? This is an incredible, staggering sum of money for well-child checks. You know, this is what the average, thankfully, most babies are healthy. 31 million uninsured, we still have the same problem, but we've inherited this albatross. Impact on jobs, this is actually from the CBO. This is not from some conservative organization. This is not from Fox News. This is a decreased total number of hours worked. You see this now in various places. Well-intentioned ideas actually have consequences, and they have unintended consequences downstream. There'll be a drop of 2%. This is from the CBO. Most workers will, quote, choose to supply less labor given new tax. Actually, I don't think that's what my patients say. They're now forced into part-time work. They have to work 2 and sometimes 3 jobs to make ends meet. This is the unintended consequences because the incentive to businesses is to have part-time workers where you don't have to provide health care. This is from the CBO. So there's a decline of 2 million jobs to 2.5 million by 2024 based on the CBO's estimate. So I just do a little score sheet. I have to grade students and residents at times. All Americans have access to quality, affordable health care. I say, well, some cases, like my colleague who's really excited about Obamacare, she's a minority of one in my social connections, but she thought it's pretty good. And there are a lot of people who don't think it's so good, like the Democrats who supported Obama even, you know. Regulated marketplace has certainly done that, and this is where it's got a profound dark side when it comes to life issues, where I have to be testifying to defend against ageism in the Oregon State Legislature. I have to defend the unborn life. I have to defend the aged life, where Barbara Wagner, as you all know, is a woman who had cancer in this state, who was given the choice of you could have no treatment because we're not going to pay for it for your cancer, but we'll give you 100% coverage for assisted suicide. Yeah, Barbara Wagner. It was reported in the Eugene Register Guard, and that's the only reason why I know about this is because there was an intrepid reporter, there's still some of those that exist, who actually uncovered that. We didn't hear about it from the Oregon Health Division. But a chilling letter that you will not cover your, and that's why I talk about the finances. You say, well, this is supposed to be about abortion. Why aren't you just talking about? If you don't think about the money, you don't see how absolutely diabolical some of these clauses are. It's really affecting life's choices. So we'll pay nothing for your cancer care, your chemotherapy, the Tarceva, the targeted chemotherapy that would give you a 45% increased chance of staying alive in 1 year, but we'll give you 100% coverage for assisted suicide, which is covered under palliative care. So extends relief to small business. I think it's pretty negative there. I don't think there's been any relief unless you think about, well, I don't have to provide health care coverage now because I'm going to dump everybody into the marketplace. So that's where you sit as a skeleton in front of the computer. They fixed that, but where you basically have choices that lead to no choices. Because when young people get into that marketplace and they see that it's going to cost them $4,000 a year, I think I'll pay the $95. Medicare, affordable prescription drugs. Well, I think that we had Medicare Part D as in dog before that covers things. We have the evil big box stores like Walmart that came with $4 a month, $4 a month, $10 for 90 days for 400 prescriptions, which forced all of the other conglomerates to have similar programs, whether it's Fred Meyer or Rite Aid or Walgreens, whatever else. And if you give people double the dose because of flat pricing, you can give people drugs that will actually last for 6 months for $10. So there's a lot of support even before Obamacare. But I say, well, maybe there's some coverage in there, but pretty much this was done before. Prohibit denials for well, I think these are supposed to be negative. Prohibit denials for pre-existing conditions. Oh, no, it does that. That's right. And we've got that by law. And limit out-of-pocket costs. Actually, that's not true. And even the supporters of the Obamacare realize that that's not true. You have to pay for this somehow. And by the way, that's not included in the cost. The cost figures I get what the government has to pay. If your premiums go up, that's not included in the $2.7 trillion. The goals and results. Dependents can stay with a plan. Absolutely, that's true. All you have to do is mandate it. They did. Expand Medicaid to millions of low-income Americans. That's true. And I'm not opposed to this, by the way. I'm not opposed to If we decide that we ought to be covering people who are too impoverished to buy it, that's a decision. You don't have to pass a big federal government act. You just have to say, let's cover more people. You could do it at the state level. Sliding scale subsidies to make insurance premiums affordable. Well, it's done that for the people who are in low income. It hasn't done it for the people in the middle class, which are the most of them, by the way. Insurance companies, are they accountable? Well, I don't think it's really done that. It's given them an out. Clamp down on abuses, it really hasn't done that. In fact, Obama's given reprieve, waivers to all of his supporters, all of his base, and that's been proven very well. Investment in preventive care, I'm a family physician, I believe in this, it's doing some of that. I'm not opposed to it. Again, it's doing it from the federal level. Just a week ago, I had to fill out one of these Medicare wellness forms. It took me about 45 minutes to do what I normally would have done in 15, because I had to have every I crossed and every T dotted, or every I dotted and every T crossed, whatever the thing is. And if I got that wrong, by the way, I get paid $0. So I'm spending a lot of time on filling out a form as opposed to actually doing what I've done for 38 years with patients, which is really take care of their health. I didn't need the government to do what I've been doing 38 years to come up with a new form created in Washington to do it. It has not helped my practice. Hidden consumer costs, I've mentioned many of them. There are penalties, I did mention that. The taxes, you can go through a lot of them, everything from tanning services to hardware devices that you put into people's hearts or into their hips and whatever. Huge taxes on these, which disincentivize one of the greatest geniuses of America, is how do you come up with innovations to help people who have severe arthritis walk with their knees, their hips. All those things are getting taxed in order to make the figure look like it's less than it is in terms of the actual costs of this program. I won't go into all the taxes, there's a lot of them. So the CBO again says, well, this thing all falls apart. If providers don't improve efficiencies to offset reduction in payment rates, cost pressures will lead to a reduction in access and quality. Access and quality. So you have to make the balance somehow. So you either have to provide less care like they did to Barbara Wagner. She's not getting quality care, she's getting assisted suicide if the state were to have their way. By the way, you know how that was resolved? One of the evil drug companies came up and said, we'll give you the drug for free for a year. And if you're doing well after a year, if you're in that 45% that's living longer, we'll give you more drug. Unfortunately, Barbara died in 6-7 months from that. But the point is that you'd think the government would have been the compassionate one, and the drug company was in the business of making money. It's exactly role reversal in terms of how we should be. It isn't clear how Congress will respond to this. I think one side of the aisle is going to say, well, we need to tax people more, and we want to spend more on whatever constituency, and it clearly is going to increase the debt. I don't know how many you follow the overall debt of the country, but there's been more debt in the last 6 years incurred by the country than all the presidents before us put together. And this is the same president who criticized and said that it was unpatriotic for Bush to spend the money that he spent. Again, I'm just making statements here. I'm not telling you to vote one way or another. I'm simply saying these are facts and you can't refute them. State costs have gone up. This is why why Massachusetts dropped their exchange and will dump that cost onto the federal exchange, which we're going to pay for either way. We're now paying for the states that dump their own exchange and then take up the federal government. So we're paying for Massachusetts, who's not been able to pass their bill. And I'll tell you a little bit about Massachusetts in a moment. The vast majority of Obamacare signups is Medicaid. 35 to 40 million new enrollees in the next 10 years is what's predicted. 35% increased cost to states, an additional $190 billion imposed on the states that they have to come up with somehow. Increased custodial cares for the disabled. And by the way, these are good things, some of them. The point is that I'm not opposed to the action. It's just, can we talk about how to get there? And I'll close with my ideas, because I don't want you to think that I'm just, picking on somebody else's idea. I'm going to show some positive things here too. The death spiral, this is by a Harvard professor, David Cutler, an architect of Obamacare. So again, he's not somebody who's coming to this meeting. He's actually somebody who believed in this. If it becomes a permanent situation that people who are healthy stay away and people who are sick go to the exchange, that becomes a very big problem. That's economic 101. It begins at what he called the death spiral. That is, you could have a situation where the only people in exchanges are very unhealthy people with very high premiums. So if you think about Massachusetts, this is literally the template which was used for Obamacare. And The total insurance cost now in the state of Massachusetts is $4.3 billion. The estimates, this is coming from Massachusetts and Kaiser and an institute studying healthcare. 8,500 jobs have been lost. Individual coverage has risen 36% since the passage. The premiums in Massachusetts are now the highest in the country. It's now 40% of the state's budget. It was 23% in 2000, so 15 years ago, it was almost half of what it is now. This is the cost of saying we're just going to do it all and have the government run it. By 2020, if they don't change the trajectory, it'll be 50% of the state budget. If you care about education, if you care that roads don't have potholes in it, if you care about other issues, you're now basically encroaching on other good things. The median income family by 2016, that's just next year, a third of their income will be going for health insurance in the state of Massachusetts. The ED visits, instead of going down by all this promotion of health and all that, they've actually risen by 35%. So one of my liberal colleagues, I'll never forget his phrase, he was doing a Pennington lecture talk, and he said, you know, before Romney Care, people went into the emergency room without health care coverage. Now they go into the emergency room with health care coverage, because they didn't change the fundamental way you deliver health care, which is, again, part of my proposal of what I would do. I think it's probably what Ben Carson would do. I haven't talked to him about this issue, but I'd love to. There are solutions to the problem. The ethical issues, getting back to abortion, and for me, contraception, as somebody who stopped contracepting as a part of my medical care back in the early 90s, because I have concerns, just as Father Tad has concerns about ethical boundaries in life, and am I really helping women's health care when I give them super physiologic doses of powerful female hormones? Did you know that birth control pills are a class 1 carcinogen according to the World Health Organization? Class 1 of 4 classes. The 4th class means it doesn't have effects on human cancer, and so it's no problem. Class 4. Class 3 is, well, you know, it's kind of a gray area in animals, we're not sure. Class 2, it might cause problems with humans. Definitely, Class 1 is it definitely is carcinogenic in humans. And I ask you the question, I'm going to ask for a show of hands. How many of you have daughters? How many of you have grandchildren that are potentially taking super physiologic doses of powerful hormones? So I made the decision that I'm not going to be part of that model anymore in early 90s. And you know, I do hormones for medical problems in the rare cases where that's necessary, but as a way to inhibit the natural biological potential for me, there are other ways to do that are ethical and non-pharmacologic. They're green, if you will. We're in a green state, you know. They don't require, these. It's interesting, we have this problem with GMOs, and we vote on these things, and we have no problem giving our daughters and granddaughters super physiologic doses of powerful hormones. How many of you would give your sons testosterone to be sure that they perform better in sports? I mean, think about it. It's exactly the same thing. We think that this is going to make you healthier. It is not. So this is why those of us who have problems, and Hobby Lobby had problems with at least 4 out of 21. I have problems with 21 out of 21 in terms of some boundaries, but they're different problems, and some of them cross ethical boundaries, not necessarily chemical boundaries. I've talked about the Little Sisters of the Poor, future coverage dilemmas. We've just heard a whole wonderful talk. Isn't he one of the most masterful speakers you've ever heard, Father Tad? So the most clarifying about embryos and the misinformation about this that you could ever hear. Assisted suicide, unfortunately, I'm an expert in the problem with assisted suicide, having lived for half of my medical career in a state where this has now empowered me to give, I don't do it, but it has given me the power, if I wanted to do it, of giving massive overdoses of pills to people to kill themselves. Some of my colleagues do that. Some of them involved with 20 or more, which means that it's not their own patients coming to them, by the way. The idea of having your personal doctor do it to keep it all under control is a myth. Required for prenatal screening, you got to do this, otherwise you're going to be responsible for the payment. This is literally what's going on in some countries, that you're being mandated to do these things. Family size, China, 1-child policy, or 2. You need a permit for your first child and your second. And anybody who believes that it's all been lifted, that it's all gone away, the government still doesn't know what the other 122 governments know, that people are power, creativity, and life. And if you do away with them, you're actually weakening your country. So China has still got a problem with family size. And by the way, they're in a death spiral themselves, even though they have a lot of people now. Ask me again in a generation or two if they don't change their ways. It's very hard. Once you're in a death spiral like Russia is, it's very, very hard to incentivize people to do the right thing. They've been in a pattern of focusing on themselves for so long that they want to take on the responsibility of taking care of others. The mandated pulse, there's a talk by Dr. Bentz. I would suggest you go to that. I don't want to get into the details of that. We wrote a 31-page paper about the problems with signing this checkbox approach to the future, that try to cover the 6,000 different scenarios for yourself. I say this is really a very limited utility for this, and we've had an impact with that paper on OHSU a little bit, although not the other 18 or so states that have different versions of this. But you got to fill this out, and this is a refusal instrument. Again, if you refuse things, it costs less. This is how diabolical this is, and you know it's a problem. Differential treatment by age, I talked about that already. So, who decides when you have these cost pressures in terms of the ethical boundaries, including abortion, end-of-life care? Is it the people? Is it the president? Well, you heard the president's reasoning recently. It's so rare that I agree with our current leadership on things that, there was one topic that we were talking about, I guess it was vaccines, where he was promoting vaccines, and in general I do too. I've got concerns about some things, that'd be another talk, but the point is that in general, vaccines have saved many, many lives. So that was one place I could agree with the president on. But it's like, it's so rare, I could probably count 5 things in 6 years that we might have commonality on. In the Congress, Nancy Pelosi or Harry Reid, who just celebrated lying about Romney during his campaign. He's Obama's president, so it was okay. It was the end justifies the mean. These are the leaders of our country. Are they the people going to decide about your health care? Is it the Secretary of Health and Human Services? There she is. It was Sebelius at first. And literally, I counted the number of times the secretary shall decide about the implementation of Obamacare. I finally gave up about 800 pages into it. I'd counted over 300 times that she has that power. This is, I don't expect you to look at the slide. I just want you to show how convoluted and complex this issue is. So we've already, instead of saving $143, we're adding $143 billion. What's a few billion here and there? Added $54 billion to our deficit. Correct? This is under congressional testimony by Sebelius, the secretary. Instead of saving $2,200 or $2,500, it's actually adding $2,200, and it's actually the net change is an additional $4,700 per family, and that's in congressional testimony. This is not a Affordable Care Act. It's, as I said, it's more likely an unaffordable. Waiting in the wings, this is more recent. This is just from Jonathan Cohn, the Huffington Post, not exactly a conservative post. There's going to be a freak out from Obamacare if in this Supreme Court ruling it actually goes against Obamacare, because there'll be millions, estimated 7 million people who will instantly be dropped from coverage and no longer have, or at least instantly have to pay the freight themselves instead of having the government pay the freight for them. Because basically they ruled that if you set up a state exchange like Oregon tried to do, like Massachusetts had, then you could be eligible for the subsidies. But if you use the federal exchange, then you would not be subsidized. So the state would not get these subsidies and grants from the government. So almost 8 million people could lose their, and the states, the southern states would be the ones that are would be hardest hit because most of them have depended on the federal subsidies and don't have their own exchanges. I talked about the waivers and how they're absolutely preferentially given to labor unions and the like, feeding your base, as opposed to just generally giving it out. It's a little bit like the non-scandal IRS scandal that Obama says there wasn't any scandal there. Well, we only happened to investigate the people who had things like Patriot in their name, and we didn't investigate or tie up. And there's actually a study out that shows that that single act did influence the election significantly and could have accounted for the outcome. So they get a big Obamacare Christmas present, and the self-insured get Scrooged. This is actually from Forbes. So the trade-off, prior to October 2013, the choices, there was really what we had, and the choices have really dropped significantly with Obamacare. Now there's some signs of this recovering a little bit because the incentives for some insurers are how to play the game, are playing the game better. So I would probably only give it 2 arrows now down. The number covered has not really come out like it's supposed. Access to care, it's plus minus depending on which financial bracket, and the costs have actually clearly climbed more. This probably deserves 3 or 4 arrows now. the government involvement is clearly robust. It's the federal mandate versus states' rights. Judge Roberts said, yes, it's okay for the federal government, because even though it said 18 times it wasn't a tax in 2,700 pages, it actually was interpreted by Roberts as being a tax, and he was the swing vote, the Chief Justice of the Supreme Court, and so it is a tax so the federal government could do it. The Hobby Lobby was a loss for Obamacare because it actually supported a fundamental principle in the United States of America, religious freedom. Freedom for religious expression, whether it's peyote that you want to smoke as a Native American or whatever. This is a fundamental, written into federal law kind of concept. And the Supreme Court thankfully upheld that, just narrowly. Can the executive branch rewrite laws? That's still outstanding right now. There have been a lot of serious executive orders that fundamentally go against the legislative law of this country. And so that's being challenged by many times. I think there's at least 24 times in Obamacare that executive action has rewritten the law without going to Congress. The subsidies for states without exchanges is the current one. It's likely to be decided in June, and it'll have huge impact depending on which way that goes. So is it working? 15 to 20% of its new customers aren't paying their first premium. The cost of insurance has risen. There are fewer choices. There's fragmentation of the previous care lines. Fragmentation leads to problems with health care. I'm a family physician. One of the things that changes everything is if you have somebody who knows you well over time. There's been study after study that proves that that's the case. You do not want to deliberately fragment care. You have to cope with that when it happens, but you don't want to set up a system that actually does that. This is dangerous. Is there a way out of the fog? I'm going to close with these few ideas. I mean, just to show you there are positive ideas. I'm sure Dr. Carson has many. You can have a service payback for commitment. For right now, residents, like I was many moons ago, I got paid to learn the last part of my medical education. What responsibility did I have because of the education that was given to me for 3 years as a family physician in residency for the money not only to get the education, but got paid for it? That's right, I had no obligation. So we now spend $10 billion every year training residents in every discipline, $10 billion through the VA system, through postgraduate medical education, and all of us as young learners after medical school have no commitment. All you have to do, you could do it by executive order. You just say, there's an 18-month payback, there's a 6-month payment, there's a 24, whatever it takes to cover every man, woman, child, and baby in the United States of America. Legal, undocumented, documented, I don't care. You'd have the doctor pool in every specialty available. It would cost, because you want to pay these people, you wouldn't want to go from having a pay as a resident to no pay, so you'd give them about half the pay that they get as a private practitioner, more pay by 50% than they get as residents, and they could do this for less than $10 billion for a year. And if you wanted to double their salary, make it almost like private practice, you could do it at $20 billion. But it's not trillions. You could expand the coverage for county clinics 24/7. Instead of being open from 8:30 to 4:30, you'd have it open 24/7. You'd build a second floor on every Multnomah County clinic. Every Marion County clinic, you'd build a second floor. We'll give them another $20 billion for remodeling. You have a medical home for everybody, so you don't have the fragmented care that I talked about. You'd have more primary care incentives. The point is that you have these simple things that are common sense. You increase the use of medical technicians for things like GI endoscopy that are simple and screening tests. Instead of having a $5,000 test or $1,800 or $1,200 test, you could do it for $250, and each person, the technician and the assistant, could be making close to $90,000 a year if you paid them $50 an hour with 2 weeks of vacation. That's how you could do this. We have ultrasound techs, and that's about the salary that they make. And you'd have 2 years of training. They'd only do that. They wouldn't have to be GI doctors that know about hepatitis C and know about Crohn's disease and the like. You could just focus on these things. You'd have hospital contributions because they make a lot of money. They'd have 5% of their profits dedicated for the hospital beds that need to be used. You'd have the pharmacy contributions, 5% of their profits, not their gross, would go to paying for the drugs that aren't covered in a Walmart 500 or 400. And you'd have malpractice caps. Our president said, oh, it's not much of the bill, it's only 1 or 2% of the healthcare bill. If the healthcare bill is $17 trillion, 1 or 2% is not chump change. I'll take 0.0001% of that and I'll be fine, you know. So, but the indirect cost, if it's only 1 or 2% of the direct cost, that is paying directly for the insurance and fighting in court, the indirect cost is incalculable, where I have to do a CT scan or MRI because I want to be sure I don't get sued, that the 1 in a million chance that it's a brain tumor is, and that happens in every emergency room every day in the United States, and that's partly it's the CYA cover the posterior. So I hopefully generated some thoughts and questions. I appreciate the opportunity to be here. I thank Gail for giving me the privilege of being here.